Hi, hello, welcome back. So today we will be seeing about CPC exam pattern 2024. So in 2024, what all topics to be covered and how the mark is being distributed, everything is added in this video. So please don't skip so that you will have a proper knowledge regarding the mark distribution and everything. So for clearing this CPC exam, the exam consists of 100 questions and the time allocated is 4 hours. And to pass this exam, you need to correctly answer 70 questions so that you can score 70%, which is considered as a pass mark for CPC exam. So in this we will be discussing about the domains which all you should prepare very well so that you can score good marks. Like it's not 70, you can score more than 70. So the topics to be prepared well are medical terminology, anatomy, compliance and regulatory, coding guidelines, ICD-10 CM, HCPCS Level II, surgery part, that is 10,000 to 60,000 series, radiology code, pathology code, medicine, evaluation and management, anesthesia, and finally 10 case studies will be added in the exam pattern, so that we can see for each topic how much marks is distributed. For medical terminology, the number of questions asked is 4, so that you should be very clear with all the medical terms across all the body system, so that you can score 4 out of 4. So next comes the anatomy part. From the anatomy part, the number of questions asked is 4. For clearing this 4 questions, you should have a sound knowledge of anatomy for all the systems in the human body. It's not like you should study in depth of that. Basic things is required, so that you can clear 4 out of 4 in the anatomy part. The third domain which you should be very familiar with is compliance and regulatory. So from compliance and regulatory, the number of questions asked is 3. So for clearing these 3 questions, you should have a knowledge regarding regulations related to Medicare coding for payment policy, fraud and abuse, etc. So most of the students will be having the notes for this, so that you can prepare it very well. So next part which is coming is coding guidelines. In coding guidelines, the number of questions asked is 7. For clearing this 7 question, you should have a proper knowledge regarding coding guidelines, CPT guidelines, parenthetical notes, as well as the modifier usage. Next comes ICD-10 CM questions. Okay. So for ICD-10 CM questions, the number of questions asked is 5. For clearing this, you should have a proper coding knowledge, like how to implement the guidelines for each question, like how to use the coding books. Everything you should be very clear. Then only you can score 5 out of 5 in this. So next comes the HCPCS. So from HCPCS, the number of questions asked is 3 questions. So for clearing all the 3 questions, you should have a proper knowledge regarding HCPCS coding, including HCPCS modifiers, supplies, medications and professional services. Next part, next domain which you should be very clear with is CPT 10,000 series code, that is the integumentary part. Okay, so integumentary part in CPT coding consists of 6 questions. For clearing this, you should know A to Z in integumentary coding, so that do at least 50 questions from the topic, so that you will know how to pick up the codes for that. So next part you should be familiar is CPT 20,000 series code, that is musculoskeletal. From musculoskeletal part, they will be asking 60 questions. The number of questions is 6, and for scoring this 6 or for clearing this 6 question, you should have a proper knowledge regarding the musculoskeletal CPT part. So next comes the CPT 30,000 series. 30,000 series is respiratory and cardiovascular. So the number of questions asked is 6. For clearing the 6 question, you should concentrate on surgical procedures on the respiratory, cardiovascular and other specific systems. Next is the 40,000 series codes in CPT, the number of questions asked is 6. So for clearing the 6th question, you should cover all the guidelines as well as the topic in the digestive system of 40,000 series. Go through all the procedures and everything. Then only you will have a proper knowledge like how to code that. Do at least 50 questions from the topic. So next comes CPT 50,000 series code, that is urinary system. Number of question asked is 6 question. For clearing the 6th question, you should assess the surgical procedures on the urinary, reproductory and endocrine system. Do at least 50 to 100 questions so that you will be familiar with all the codes. Next come the CPT 60,000 series codes. So the number of question asked is 6. For clearing the 6th question, you have to involve the surgical procedures of the nervous system. So go through the topic from the beginning till the end of 60,000 series. Underline each and every point which you feel like it is important, and try to do at least 50 to 100 questions so that you will be familiar with all the codes. So next come the radiology part, that is the 70,000 series code. So the number of questions is 6. For clearing all the 6 questions, you should focus on the diagnostic and interventional radiology. For the previous topic only, you have to read from the beginning till the end and underline whatever you feel important, and then do at least 50 to 100 questions from that topic so that you can clear it very easily. Next come the pathology and laboratory codes, that is 80,000 series code. The number of questions is 6. For clearing all the 6 questions, you should have a knowledge of organ and disease panel, drug testing, therapeutic drug assays and various pathology procedure code. Same I am repeating here also. Do at least 50 to 100 questions so that you can very easily clear this 6 questions. Next is the medicine part. The number of questions asked from this is 6 questions. To clear this, you have to cover the specialty, specific coding scenarios and various therapeutic and diagnostic procedures from this. Same like you have to study it from the beginning till the end of the part, and give more focus for the hydration part and all, so that you can clear it very easily. Next come the evaluation and management part. For evaluation and management, the number of questions asked is 6. For clearing the 6th question, you should assess the coding proficiency related to different services, settings and scenarios. For this also, you should practice doing at least 50 to 100 questions, and see the 2024 updates for this so that you can clear it very easily. Next is the anesthesia part, which is very easy part. The number of questions asked from this is 4. For clearing this 4 questions, you should test the knowledge related to time reporting of anesthesia, qualifying circumstances and modifiers for anesthesia services. You have to see that AAAD modifier and all is there, no? Go through that also. Next is the final part, that is I told you, there will be 10 case studies in that. So the number of question is 10. For clearing all the 10 case studies, you have to evaluate the ability to accurately code medical record documentation using CPT, ICD and HCPCS Level II code. So that for these 10 scenarios, you will be applying ICD, CPT and HCPCS. So this is all about like how the mark is being distributed. Okay, so for CPC exam cutoff, as I told in the beginning, you will be having 100 questions. Time allocated is 4 hours. For that, you have to clear at least 70 questions must be correct. Then only you can achieve the pass percentage. Okay, so this is all about CPC mark distribution. If you have any sort of doubts, you can put it in the comment box also. Thank you for watching my video. Take care. Bye bye.